Today we'll be having the lecture on the universal health precaution, biohazards to the healthcare workers, and one of the important part, preventive part that we are going to see in the last part of this lecture is about the vaccination. So one of the thing all of you might have observed in the year 2020, in the December 2019, there was in one city of China this coronavirus, the COVID-19 that has started, and no one might have imagined that it will spread like this and the pandemic that can be there. And one of the things that we have learned in relation with this particular disease is the disease was new to us. There were not many correct treatment or the confirmed treatment that was available in relation with the COVID-19, and whatever the thing that we have observed throughout the year is about the preventive practices. Simultaneously we are trying in relation with the finding out the vaccine, or we are testing various drugs in relation with the treatment for the COVID-19. But one of the important aspect that you might have understood is that instead of the curing any disease, or there is one line that is famous, that is the prevention is better than the cure. And let me congratulate all of you for getting the admission for one of the noble profession, medical profession, in one of the prestigious institute, the Royal Medical College, Loni Institute of Medical Sciences. So about the introductory part of this lecture, the three keywords that you might have understood when I have said the title. One is about the universal health precaution. So you are going to understand what is the meaning of the universal health precaution when I am saying this word might be new for you. Second important word in relation with or the keyword in relation with this today's lecture is about the biohazards. So we are going to understand what is the exact meaning in relation with the biohazards. And the third important part, as I have said, in relation with the corona or in general also, that is the prevention is always better than the cure. Instead of treating the disease, there are many ways we can prevent the occurrence of that particular disease. And one of the basic thing in your school days also, you might have heard about the immunization, and the various vaccines are there. What is the immunity, why we are giving these vaccines, how we are protecting the disease by giving the various immunization. So we are following in our country, in India, we are following the national immunization schedule. So I think this is the right point to sensitize the first MBBS student about what is our national immunization schedule, what are the different vaccine. Even the child is born, or the child is born in our country, he or she is immediately at the risk of development of the certain diseases. So since birth we are giving the different vaccine. Up to the certain age period we are giving, at certain intervals we are giving the different vaccine. So at the end of this lecture you will also understand what are the different vaccine, what are the different what is their dosage schedule, route by which we are giving these vaccines. So that will be the last part in relation with this lecture. So going back to our topic, again I repeat here, the today's topic of this lecture is about the universal health precautions and biohazards to the healthcare workers, and the last part, as I have said, is about the vaccination. So what is the universal health precaution? Now the first day you are landing in medical college, maybe you may not be directly exposed in your first year to the patient, but as we are now adopting the strategy of the early clinical exposure, you might have certain visits in the clinical department as far as the first term of the first MBBS is concerned, and you should aware at this particular stage what precaution that you should follow whenever you are contacting with the patient. So when we are treating the patient, it is equally important as a medical student, as a healthcare worker, as a doctor, or as a nursing student, we should take precaution so that we should not contact that particular disease. And when I say universal health precaution, universal health precaution is nothing but we are preventing we are taking precaution in ourselves, because as you know there are different types of the body fluids that are released. One of the thing, as we know, if we are performing certain operative procedure or we are performing certain uh, invasive procedure in the patient, we are exposed to the different types of the body fluid of the patient, and at that time it is necessary we should take precaution. One of the example, throughout the 2020, what you have done, all of you have familiar with the wearing of the mask. And what is this is a simple example, so you can understand, instead of using a big word, instead of using the complicated thing, you have used throughout this year, you have used the mask, and this is also one of the part of the universal health precaution. So what you have taken the care when you are using the mask, you have attempted that you will not contact this corona infection. You might have used this mask or other precautions like the sanitizer, using the sanitizer. So to make you familiar with this subject of the universal health precaution, two recent example that we can take. One is, throughout the year we have used the mask. This is also part of the precaution, health precaution, universal health precaution. Every time we have done the hand washing, every time we have used the sanitizer. So these are the few examples in relation with the universal health precaution. The next part of this lecture, as in the heading, is the biohazard. So what is the meaning of the biohazard? Already we have cleared this topic, that when we are dealing with the patient in the ward, in the operation theatre, the various body fluids that are released by the patient, and if we come in contact with these body fluids, there are chances that we may contact that particular disease. Another important aspect that you will learn when in the third year is in relation with the biomedical waste management. So why these biomedical waste, what are the different types of the biomedical waste that are generated in the hospital, you will come to know, and how to dispose of these biomedical waste, so there should not be any hazard for the healthcare worker as well as the other patient that are admitted because of the different types of the disease in the hospital. And the last part of the heading, as you can see, is about the vaccination. So at the end of this lecture, we will be learning about what is our national immunization schedule, which vaccine that we are going to give to the newborn child till he reaches to the 10 year or the 16 years of the age. So to beginning with, first you should know what are the learning objectives in relation with the lecture, in this particular lecture. At the end of this lecture, I expect that you will understand and become familiar with the various universal precautions. And to simplify, I have given you one example, that you have used mask, you have done the hand washing, you have used the sanitizer. All this is the part of the universal precaution. Second thing, as we have discussed in the title, that is, we are going to understand and become familiar with the national immunization schedule. So this is the basic thing. As a doctor, as a medical student, we should familiar with there are certain diseases, what we call it as the vaccine preventable diseases. So if the child is immunized at right age, there are possibility, so many complication of these diseases or these diseases can be prevented in future. So last part we will be learning about the national immunization schedule. Now coming to the first part of this particular lecture. So as we are using the word universal precaution, so here you can see what is the meaning of the universal precaution. What are the universal precaution? Universal precautions are nothing but they are the control guidelines designed to protect workers from exposure to the diseases spread by blood and other body fluids. So as now you are entering to the medical college, you are familiar that if you are giving certain injection, you are doing the certain procedure, you may accidentally may come in contact with the blood. But is it the only blood is the thing that will transmit the disease? But whenever the patient is admitted in the hospital, there are many other body fluids that are there that might be infectious, that can cause the disease to the healthcare worker, and what precaution we should take when we are in contact with the patient, which are the different body fluids, that we will try to understand in the first part of this lecture. So why universal health precautions? I hope now already you are familiar with the topic that I am going to discuss here. The concept of universal health precaution emphasizes that all our patients should be treated as though they have potential bloodborne infection and can infect the caring healthcare workers. So, as you know, when the patient is admitted, we may not have done the different types of the investigation in the first or second day. We don't know whether the patient is HIV positive or whether he is HIV negative. So, every patient we should treat that he may be infectious, he may give us infection, and as again I repeat here, the prevention is better than cure. So we should take the proper precautions, so we should not contact that particular disease. So this is the simple idea in relation with when we are talking about the universal health precaution. Every patient we should consider as a suspect or as having the certain infectious diseases, and naturally whether he is a doctor, whether he is a nursing person, he should take precaution so that he will not contact that particular disease, and also he will not spread that disease to the other patient. When he is handling, he is taking the round, he may see 15-20 patients, and if he do not follow this particular precaution, he may transmit the disease from one patient to another patient. So this is the idea in relation with the universal health precaution. I hope now you are familiar with this particular topic. Second part, we have discussed already that we are dealing with certain procedure, if we are giving the injection, there might be accidental exposure to the blood. But is the blood is the only body fluid that can transmit the disease? So here you can see the list of the different body fluids that you may come in contact when dealing with the patient. First is definitely the blood. There are many diseases that can be transmitted if we come in contact with the infected blood or blood products. Second is the semen. Third is the vaginal secretion. That these are the certain fluids in the first slide that are considered as a highly infectious. Then CSF, that is the cerebrospinal fluid. There are some procedure when we are doing the tapping, we are drawing the CSF for certain examination in relation with, suppose for example the child is having a convulsion and we want to know whether there is a meningitis, he is having the meningitis, or we want to know the exact cause of the disease. At that time we draw the cerebrospinal fluid for the laboratory examination. So this is also the fluid that can be infectious. There are synovial fluids, amniotic fluid, and all other body fluid that we are going to see in the second slide. These are the some other things that can be infectious. We know there are many waterborne diseases are there, and in relation with these waterborne diseases, one of the important route of the transmission is the fecal-oral route. So the feces, even the nasal secretion of the patient, many of the diseases that you will be seeing, learning in second year and in your third year is about the various communicable diseases that are there, and they are classified depending upon their mode of the transmission. So most of the respiratory infection, what you will observe, whether it is a tuberculosis or it is respiratory infection, that is whenever we come in close contact with the patient who is coughing or sneezing, that is the mode of route of the transmission in relation with this. So even the nasal secretion and what precaution we can take, that we will discuss in the next slides. Sputum, as you know, the one of the example already I have given, that is of the tuberculosis. One of the commonest disease in India, if I ask you, the answer for this particular question is tuberculosis. And we know if the patient is sputum positive, and if we come in contact with the sputum positive patient, there are high chance that we may get this particular disease. Although there are many other factors are also there, the host factors like the immunity of the person or the topic that we will be discussing. If we are taking the proper precaution, universal health precaution we are following, we may not get that particular infection. And hence this is the importance of this particular topic, how to prevent the disease in ourselves when we are dealing with the patient, and how we should not spread the disease from one patient to other patient. There are some body fluids may be of less importance, but they might be infective, that is the tear, urine, saliva, unless it is the blood stain. So now you are familiar with what is the meaning of universal health precaution. Now you are familiar with the various body fluids that can be hazardous, that can transmit the infection, whether it is from patient to patient or from patient to the healthcare worker. So in the next part, now as I have said, although the title may look something what is the universal health precaution and likewise, but here will be discussing very simple thing that already you are familiar about. It is nothing that you are not knowing these things before coming to the medical colleges, all these procedure that you are following. Now again, one of the good thing or positive thing I can say in relation with the corona, that you are everyone, even the general public awareness has increased in relation with this is a simple procedure. You may underestimate this, but the simple hand washing can prevent the many diseases, and 2020 is the one of the example where we have learned the importance of the hand washing. That is a great lesson that has been given to us by the corona infection. So why hand washing is important? What is the importance of the hand washing? There is no any health precaution like hand washing. Washing with simple toilet soap that will reduce the rate of the transmission or the common infection, including the HIV. So in your first year, if you are performing the dissection, you will be exposed to the cadaver. Naturally you will be using the hand gloves when you are performing your dissection in the anatomy department, but simultaneously, even if you have used the gloves, the hand washing and all this, that is also equally important, and that will prevent the many diseases. So when I am talking about the hand washing, many times we are not familiar with how to do the proper hand washing, and that is again one of the important thing. I think you should be sensitized when you are entering at the medical college. So see, in this diagram you can get the idea how the proper hand washing is done. In the, suppose you go, this is the first procedure first. Procedure 1, this is the first step in relation with the hand washing. What should be done? What is done here? The wet the hands and wrist. So not only the fingers that are that need to be washed, but up to the wrist part. We should wet that particular hand and then apply soap all over the hand. Then this is the second step in relation with the hand washing, that the right palm over the left, and again we can reverse this particular procedure. So in the step third, we are rubbing palm to palm. So not any single aspect in relation with the hand that we are want to miss. Not a single part we want to miss when we are doing the way this procedure that has been shown in this particular figure. Then back of the fingers is operating the remaining the fingers in relation with the, so here what we are doing, the interlocking of the finger that we are doing, and whatever the inside part of this finger, that also we are cleaning when we are doing the hand washing. Then with the help of the thumb, we are doing the cleaning, hand washing in this particular next step, and even the rotational rubbing backwards and forwards of the fingers and thumb of the right hand, that has been done in the last procedure. So each and every part of the hand up to the wrist we are doing hand washing if we follow these proper steps while we are adopting the hand washing. Now again, what are the indication of the hand washing? Whenever, as a doctor, as a healthcare person, if you are in prolonged contact with the patient, definitely this is a common sense, and one of the sentence that I will be discussing in next slide, here we will understand, if we use our common sense, the many complications that can be prevented. Naturally, if you are in contact with the prolonged contact with the patient, the hand washing is indicated before taking care of immunosuppressed individual. So again, the risk of transmission of the disease is there, many diseases that are there where the immunosuppression, and one of the, to begin with, what is the name of the AIDS? That is the acquired immunodeficiency syndrome. So what happens in the disease? It is not like that there is one single thing that is happening. It is a group of the symptom signs that are present when the person is having the AIDS, and what happens exactly in the AIDS, the immunity of the person is broken, and then the various organisms take opportunity to infect that particular person, and we call it as the opportunistic infection. So as a healthcare worker, as a doctor, if we are dealing with the immunosuppressed patient, definitely this precaution that we should follow. Naturally, newborn infants, whenever we are doing the examination of the newborn infant, even if we are taking the simple pulse, or we are doing the per-abdominal examination, at that time it is necessary, before and after the examination we should do the hand washing, because newborn infants and all, they are more prone for getting the infection from the external environment. Then ICCU, definitely in operation theatre, all these precautions that are followed. Burn units, again the chances of the transmission is here, so you should take precaution before and after touching the wounds. Now again, this is the thing of the common sense, that you should do the hand washing. So these are the various few example that I have given you when the hand washing that should be followed. What to be used for the hand washing? Initially, as I have said, the simple soap and water, that will also be better rather than not doing any hand washing. In most circumstances it will be useful, but there are some demanding circumstances where you are handling potential harmful infection. In that case, the as we are nowadays, we are using the sanitizer, so if they contain the ethyl or the isopropyl alcohol or the agent like the chlorhexidine, povidone iodine, these will be more helpful in this particular situation. So you might be surprised, in this particular lecture, the first part we have given the stress on the simple procedure like the hand washing. But why we need to educate the people about the hand washing? This is been before the ages, before the many years. This is the quote by William Osler. What he say: the soap, water and common sense still are the best antiseptic. So if we use our common sense when we should do the hand washing and all these things, many infection that can be prevented, that are preventable. And in relation with the developing country like India, the importance of the hygiene, as we are facing the double problem of the infectious diseases. So in the developing country, what is the problem? It is not that the non-communicable disease they are not common. We are in the double jeopardy. At one end, because of the unhygienic practices, because of the lower socioeconomic status, or the condition in which people they are living, unhygienic conditions, we are facing the problem of the infectious disease. At other end, simultaneously the hypertension, blood pressure, hypertension, diabetes, like these are the certain lifestyle related diseases that are also emerging. So hence I have said we are facing this dual problem. At one end there is an infectious disease, at other end we are facing the non-communicable disease. So as said by the William Osler, if we use our common sense, many diseases that can be prevented in the community. The next part, now we have talked about the simple procedure, relatively simple procedure, that about the hand washing. Next precaution that you can do, that you can take is the use of the gloves. Particularly in the laboratory healthcare workers who are dealing with the blood and other products, definitely you might have observed they are using the gloves. So the use of pair disposable plastic gloves protects, and whatever the chances of the contact that will be there in relation to the blood and body fluids, that can be prevented if we are using the gloves. As a first thing that you will contact, as I have said earlier, to the cadavers, and whenever you are entering in the dissection hall, you should have your gloves. So this simple precaution that will also help in prevention of many diseases. Another thing, as to make you familiar with the concept of the universal precaution, I have given you the example in relation with the corona to begin with, and every one of us, we are using mask. Even if we are going in the market or any other crowding places, 24 hours, whenever we go outside our home, we are using the mask. That initially that was limited in the hospital only. So this mask is another thing, as I have talked you about the various respiratory infection. So another advantage in relation with the corona that might be there, as we have used mask, the low level of the pollution that all of we might have observed, or along with the corona we might have also prevented many other respiratory infection in this last year, in the year 2020. So definitely the mask is another measure in relation with the precaution that will protect us from many diseases. Another thing, here you can see in this particular diagram, in this particular photograph, that healthcare worker in this photo, they are not only using the mask, but here the cap, hair cap, that is also used. So there is also risk of getting the infection. Then the goggles that are used, eyewear that are used in relation with this. So all these simple things that we are discussing, all these are the part of the universal health precaution. So the stringent use of mask and cap can save several lives in the hospital. So you should understand the importance of the using mask, not only for yourself, but you can prevent the transmission of the infection in the community also. Then another aspect that is important, that may neglected, that is you should use the proper footwear. There are chances, there may be the cracks in our feet, and here there is a risk of getting the infection is there if we are not protecting our feet. So apart from hand washing, using the mask, using the proper eyewear, using the head cap, using the footwear, all these are the simple things that are part of the universal health precaution. Then if we are dealing with the patient, if we are in the operation theater, using the simple plastic apron, that can also help us in relation with the prevention of the various diseases. Now we have seen the some basic universal precaution. In the next part, that we should have knowledge as a medical student in relation with the disposal of the needles and sharps. As you know, suppose you have given the injection to one particular patient and the proper precaution is not taken, that needle is not properly disposed of, there are chances of injury, the accidental injury that can happen to some person, and that can result the any blood-borne infection, that can be the result of this particular carelessness attitude of us. So it is equally important when you are giving the injection or you are following any particular procedure, the proper disposal of the needles and sharps should be done. As a part of your first MBBS, along with the theoretical lecture, we are having the limitation. We are conducting the foundation course now online, but whenever the offline course was there, we used to take you all the first MBBS student. There used to be have the visit in the casualty department of our Prora Rural Hospital, and there you can see what I am going to show in the next slide, that is the how this shading of the needle is done. So it should not be bent or it should be recapped and thrown out. Likewise, that after every injection procedure, this is there is one machine is there. Whenever you will coming back to the hospital, coming back to the college, you should visit the casualty department, and you will see there is a small machine is there. So it is used for the shading of the needle, so there is no any further chance of transmission of the blood-borne infection. Dealing with the needle stick injury, now as a healthcare worker, there is still chance, some because of some accident, maybe we may have the needle stick injury. And what precaution that we should follow if we are having the needle stick injury? First thing is again the common sense, that we should wash it, that particular part, with the soap and water. Bleeding should be encouraged, so whatever the infection that is there, that will also be not there. Then one of the important thing when we are having the needle stick injury, and that we should worry, if the person we have injected or that particular needle, there are chances of getting the HIV and hepatitis B infection. And if the suspect is on the HIV, then we should take the antiretroviral prophylaxis. So there are certain antiretroviral drugs that are used for the prophylaxis, so even after the needle stick injury, that person will not get this HIV infection. So these are the some thing that you need, that you should be aware. And the best thing is that when we are dealing with the patient, whatever the procedure that we doing, we should avoid the needle stick injury, because that is also one of the way where we are at risk of getting the infection. What are the hazards? The some common diseases we will discuss here in relation with the needle stick injury. If you are not taking precaution or you are having the accidental injury, the three diseases that you might be familiar about, which are transmitted by this particular route. One is the HIV, then second is the HBV, that is the hepatitis B virus, and third is the hepatitis C virus. So these are the viral infection where there are more chances of getting if we are having the needle stick injury, and if we take the proper precaution, that can be prevented. Next part, we have learned about the needle. Another thing, we are using the various hospital linen, and it is also equally important. Whatever the precaution that we have discussed, if you have taken all these precautions, even then there are some other thing that are used in the hospital that also need to be disinfection. So one of the thing that is commonly used is the hospital linen. So the solution that is used for the decontamination is 1 in 100 bleach solution, or in certain condition the autoclaving is also indicated for the various instrument. Now if suppose there is an accidental spillage of body or body fluid is there, what you should do, it should never wipe the whatever the spillage that is there on that particular floor with the help of the wet mop, but the first thing that should be we are going to do is the apply cover over whatever the blood spill that is there with the help of the paper, and on this particular covering we should apply the 1% hypochlorite or the bleaching powder to decontaminate that particular spills that may have HIV or HBV virus. Now you are, as a first ABBS student, you are not going directly dealing with the disinfection of the instruments. In second MBBS, in microbiology you will be learning about the various disinfection and the autoclaving procedure, everything in detail. But as we know, as I have said, we are using the linen that can act as a source of infection. Another thing, we carrying out the various procedure, we are using various instruments, and there are certain guidelines, there are standard operating procedures that are there that we should follow when we are dealing it. One of the, for example, if the endoscopes are there, so what solution that we are using for the disinfection is the glutaraldehyde solution, that chemical that is used. So we can use the same endoscope in other patient. If we are not disinfecting this thing, then there is a risk of transmission of the disease from one patient to other patient is there. So not only the personal protective measure that are important when you are in the hospital, along with that these linen instrument and all these things we should take the care. Then there are certain metal instrument that we are using in the hospital. So here also we can use the 2% glutaraldehyde solution for the decontamination. Now whenever we are giving anesthesia to the patient, various tubings that are used, if it is disposable then no problem. If the certain tubing that are not disposable, we are using it, in that condition it is necessary we should decontaminate it with the help of the 2% glutaraldehyde. If we are not doing it, then there is a chances of transmitting the infection to other person where we are performing the same procedure. Another important high risk category person is there is the pregnant healthcare worker. Why? Whatever the precaution we are taking in the normal person and the pregnant healthcare worker, that might be same, but here we should be more conscious, because if we neglect the universal health precaution in the pregnant healthcare worker, as you know, there are certain diseases that are transmitted from mother to child, and there is a risk that if that particular mother do not follow this particular precaution, if she is having certain infectious disease, suppose like hepatitis B or the HIV infection, there is a certain percentage of the risk that is there, she will give infection to that particular newborn. So the more stringently we should follow these universal health precaution if that particular healthcare worker is pregnant. Operating on high risk group of the patient. Now many times if we have done the investigation, we know the status of the patient. If he is HIV positive, we should not have the stigma when we are dealing with the HIV positive patient. We should give equal treatment whether the patient is HIV positive or HIV negative, but at the same time if we should follow all the universal health precautions that we have discussed. So Adherence to the universal health precaution, if we are dealing with the person is HIV positive, or he is a hepatitis B positive or hepatitis C positive, that is equally important. And we don't know, many times we don't know whether what is the status of the patient, whether he is a positive or negative. And as earlier I have said, we should treat every patient as a suspect. We should consider every person is having the infection, and we should protect ourselves as well as the other patient that we are dealing with. If you are in the obstetric gynecology department, many times the normal delivery, the cesarean section, or the various procedures that are performed, and at that time also risk is there. If we are handling the placenta, we are handling with the newborn, blood, amniotic fluid, all these are the body fluid that we get exposed, and at that time also the whatever the universal health precaution that we have discussed, that should be strictly followed. Even for dental professional, they are at risk of these exposure to the blood, saliva, gingival fluid from all dental patient. We should consider them as infective, and whatever the procedure that we have discussed, that should be followed in each and every patient. It may happen, some suppose in casualty the patient, because of some accident that is there may be spillage of the blood all over his mouth, and we are thinking of giving the mouth to mouth resuscitation. It should not be avoided just because he is having the bleeding, but it can be, these bleeding from mouth can be wiped out, and whatever the necessary, the CPR that should be given to such patient after following proper precaution. So the bloodborne pathogens that are particularly at risk if we do not follow the universal health precaution, these are the hepatitis B, hepatitis C virus, and the HIV. These are the important. There are many other infections that can also result, but these are the three important things where the high risk is there. More than 400 million carriers, they are having the hepatitis B infection. So it is important for every healthcare worker, he may at risk of contacting this particular infection. And what as a healthcare worker we should do? There is a vaccination. Fortunately, the vaccination that is available, and that is again, the vaccination is a major component of the universal health precaution. So when you will be entering to the medical colleges, maybe after 1 or 2 months, last 2-3 years, as a activity of the Department of Community Medicine, we have conducted the hepatitis B immunization for the first MBBS students, and it is important all healthcare worker should must take the hepatitis B vaccine. What is the schedule? You should be familiar with. You should be familiar with the schedule. That is the 0, 1 and 6 months. So what is the meaning of 0, 1, 6 months? Suppose today I take the hepatitis B vaccine, that will be considered as a 0 day. The next dose will be after 1 month, and third dose will be after the 6 months from today. So this is the dosage schedule in relation with the hepatitis B vaccine. And as I have said, every healthcare worker, he should be immunized with this hepatitis B vaccine. The last part of this lecture that we will be discussing in brief, so you should be sensitized with our universal immunization schedule or the national immunization schedule that we are going to follow. As I have said earlier, if you are born in India, immediately after your birth, you are at risk of getting the infection. And which is that particular infection? As we know, there is a higher incidence of and prevalence of the tuberculosis in India. So immediately there is birth of the baby, he is at risk of getting this deadly infection. So there are certain immunization procedures that we are following. There are certain diseases, what we call it as the vaccine preventable diseases. So if we do this properly, they follow the national immunization schedule, there are many diseases that can be prevented in newborn child. We are developing the immunity. You might have some knowledge in relation with the immunity. What is the immunity? What is the active immunity? What is the passive immunity? So the immunization is one of the important part by which we are developing the immunity in this particular person. So as a last part of this lecture, as I have told you, briefly we'll take glance at what is our national immunization schedule that we are following. Also here in brief I will discuss about the recent updates in relation with the national immunization schedule. So this is the last slide of this lecture. You can see as I have said, immediately after the birth of the baby, which vaccine we are giving is the BCG vaccine, in relation with the prevention of the tuberculosis, and particularly the in under 5 age group, the tuberculous meningitis is very dreadful infection. So that can be definitely prevented if we are giving the BCG vaccine. Along with the BCG vaccine, as recommended by World Health Organization, we are giving the 0 dose of oral polio vaccine, and the hepatitis B birth dose, 0 dose, we are giving immediately after the birth of the baby. The next, simultaneously, what we are doing, whenever newborn we are giving this vaccine, along with this there is immunization card that is available at healthcare facility. We are giving this immunization card to the mother. We are putting the next date when she should visit along with her child for this immunization, and next after the birth we should ask the mother to come at the 6 weeks, 10 weeks and 14 weeks after the birth of the baby. And which vaccine we are giving? We are giving the oral polio vaccine. Every one of we are familiar with the success story of the oral polio vaccine, the whatever the eradication of the polio and all these things that we are want to achieve, and it is because of this vaccine, oral polio vaccine. Along with OPV, we are giving the pentavalent vaccine at 6, 10 and 14 weeks. So initially we used to give only DPT. Now in single prick we are giving the 5 vaccine when we are giving the pentavalent vaccine. Recently the vaccine that is added in certain state, that is the rotavirus vaccine. It is also 3 dose, that is the rotavirus 1, rotavirus 2 and rotavirus 3 at 6, 10 and 14 weeks of the age of that particular child. Then recently, that is again one of the update in relation with the national immunization schedule, along with the OPV. Many years, if we see last 4, 5 or 10, 15 years back, we used to give only oral polio vaccine. But now we have, in addition to the oral polio vaccine, we are giving the fractionized dose of the IPV, that is the injectable polio vaccine. And as far as the personal protection is concerned, the IPV may not have any benefits for the community, but for 100% personal protection, or if you go to the developed country, they are not giving the oral polio vaccine. What they are following is the injectable polio vaccine. So here also we are giving the small dose, fractionized dose of the IPV, and whatever it's mentioned at 6 weeks and 14 weeks, the PCV vaccine, and you can see the star is there. So it is not given in all the states. High risk state we are giving some vaccine. So wherever this star you are seeing, this is not covered in all over India. In certain high risk state only we are giving this particular vaccine. 9 months. You should have update in relation with the, recently you might have heard about the MR campaign, that is the measles rubella campaign. So up to the many years we used to give only measles vaccine at the age of 9 months. But what is recent modification or recent update in relation with this? Now instead of the measles, we are started giving this MR vaccine. And what is the full form of MR vaccine? It is the measles and rubella vaccine that we are giving at the age of the 9 months. Along with the measles and rubella vaccine, we are giving the vitamin A first dose. And as I have said, wherever you are seeing the star after the name of that particular vaccine, it indicates that this Japanese encephalitis or the PCV, these we are giving only in certain state, not all the state where the risk is not there, we are not giving this particular vaccine. Now one of the thing that you will observe here at the 6 to 24 month of the child, here what we have given at 6, 10, 14 weeks, pentavalent, it contains the DPT, 3 vaccine already, it contains the diphtheria, pertussis and tetanus. But here at 6 to 24 months, instead of giving the pentavalent, we are giving only DPT vaccine. The pentavalent is not necessary. So the first booster dose of DPT we are giving at the age of 6 to 24 months. Then again here we have given OPV first, second, third dose. So booster dose of oral polio vaccine we are giving at 6 to 24 months. And as I have said, we are not giving measles, we are promoting the measles and rubella vaccine second dose that can also be given at the 6 to 24 months. At 5 to 6 years, again one update that is there. Initially we used to give the only DT vaccine, but now from last 4-5 years we have started giving the DPT vaccine at the age of the 5 year as a second booster dose. 10 to 16 years. Again, I want to update you in relation with the 10 to 16 years. Many years we used to give only the tetanus vaccine, but now we have added the adult diphtheria component in relation with this, and we call it as the TD vaccine. And same thing we follow in relation with the pregnant woman. Instead of giving only tetanus vaccine, now we are giving the TD1 first dose in early pregnancy, second dose after the 4 weeks, and the booster dose if pregnancy occurs within the 3 years of the last pregnancy and a second dose has not received. In that particular situation we are giving the booster dose. अरे बंद झालं वाटतं, बंद झालं लागेल, करता येईल का चालू? चालू तेवढं ते दाबलं लागेल माझ्या खालचं. Sorry, because of some technical problem. So I hope you have understood what are the universal health precaution. Initially you might have thought what is the concept of the universal precaution, but we have not discussed any complicated thing in relation with the universal precaution. We have discussed what are the simple thing, what are the common sense if we use many diseases that can be prevented. You have understood the various different body fluids that are infectious in relation with the transmission of the disease, and what are the simple precaution that we can take. Another aspect you have learned in this particular lecture, that the linen or the various instrument that we are using for the various procedure, here also the decontamination is necessary, the various procedure, various chemicals that we are using so that we are not spreading the disease from one person to other person. Even simple thing, like if we are nowadays that already you know, we are not using the same needle for giving injection from one person to other person. We are using disposable needles and syringe. That is also important part in relation with this particular precaution. And last part we have discussed, although that topic is again vast, but in 5 minutes I have tried to sensitize you, introduce you in relation with the what the national immunization schedule we follow whenever the newborn child is there, from the age of the 0, that is immediately after birth, up to if he reaches to the 16 years of the age. All these vaccines that are necessary, so many diseases that can be prevented in that particular child. So thank you, hope you understood this particular subject as per my learning objective. Thank you.
Attitude, ethics and communication. And we have got Dr. M.C. Tayade with us. Dr. Tayade is professor in physiology. Dr. Tayade has completed advanced course in medical education. He is active member of our medical education unit, and he is also looking after our scientific journal Program Medical Review as editor, managing editor. He is also active member of bioethics unit of PIMS, and he has written one book on textbook of bioethics, which was published a couple of years ago, and many copies were sold. It is also available on Amazon. And one more book on early clinical exposure by same author, Dr. Tayade, will be released in first week of February. So Dr. Tayade will be taking 2 sessions for you now. First is introduction to attitude, ethics and communication, and then he will give a book review of his own book, textbook on bioethics. So over to Dr. Tayade.
Good morning, students. Good morning, students. First, I'd like to congratulate all of you for taking the admission for this MBBS course. Sir has earlier introduced me. I, Dr. M.C. Tayade, working as a professor in physiology. Today, the topic allotted to me in foundation course is Introduction to Medical Bioethics and ATCOM. Now when we see this ATCOM or bioethics, this new area is introduced by the Medical Council of India, or nowadays that is shifted toward the NMC. The Medical Council of India and NMC introduced this medical bioethics ATCOM as a specialized area, as a new subject area in our medical curriculum, in our reforms that are recently introduced in our CBME curricula. I hope you are aware about the CBME, that is competency based medical education. In CBME, that is introduced by the government or NMC in 2019, and they introduced this area. Now the question is, in our foundation course, why NMC introduced ethics as special subject in our UG as well as postgraduate curricula? Why the NMC introduced ATCOM as special subject area in our curricula? The reason behind it, our medical education traditional pattern was basically based on knowledge criteria. There was found a lack of attitude focused education in this education pattern. But when we see the exact learning on the basis of scientific infrastructure, that is Bloom's taxonomy, it is based on knowledge, skill and attitude. That means when any professional is formed or is educated or is prepared using our education system, there is required knowledge, skills and attitude. Now just imagine you have only knowledge as a doctor without any skill and attitude. What will happen? Just imagine, just think this. Only knowledge based approach makes you like this. Only skill based approach makes you like this. And only attitude based approach makes you like this. But we require the integration of knowledge, skill and attitude based approach so that we will become competent as overall. That is required to our society. Because the doctor's basic approach to the society is with his competency, competent knowledge, his competent skill and his attitude that is required during our clinical practice. But when we see the scenario or the context of clinical practice that is observed in this decade was very frank, it was just on money practice. The last 2 decades or 3 decades, the medical practice shifted toward just corporatization on money-based practice, and that resulted in violence against doctors. Now, the question is, what is right, what is wrong, how I will decide it? Because there are a number of circumstances occurs in our clinical practice where we have to decide which is the right thing, which is the wrong thing. What is my decision that makes me right or wrong? What should I do when a patient comes in emergency or patient come to my clinic or patient I expose with my patients? That time I have to take decision. I have to diagnose that case. I have to decide the treatment plan. I have to give the option to the patients. And on what basis that I should do it? What are the options that makes me ethically right or wrong? The ethics, that is the basic component that should adopt by every professional in his career or in his approach in his practice. When you see the ethics, especially in medical science or medical practice, it is one of most important part. It is one of most integral part of our practice. From centuries, that kind of practice is applied in a regular schedule or in regular clinical practice from the centuries. But nowadays, in modern medicine, this ethics is introduced as a specialized capsule to us. Now, when you see the term as ethics, bioethics, bioethics is the study of controversial ethical issues emerging from new situations due to advances in biology and medicine. Now, when we see this history of this modern bioethics, the term bioethics was introduced in 1926 by Fritz. When we discussed the scope of bioethics can expand with advancements and inventions in healthcare sector. When we see the importance of bioethics, bioethics education for medical practice is essential in today's complex world because medical policies and patient rights legislations are ever changing. Secondly, the healthcare system functions differently than before, and clinical practice now involves decision making about many new issues. There are a number of reasons, hence we should adopt bioethics from the first day of our education. And with this background, the Medical Council of India, as we are now introduced NMC bill or NMC committee, has introduced this bioethics in our curriculum from first MBBS. Now the question is, in our foundation course, what is the need of clinical ethics? Nowadays, the relevance and need of ethical issues is prominently underlined due to modernization or advancement in clinical practice. That is the main reason that is responsible to be an emergency, to be a need to introduce clinical ethics in our practices. These new technical updates, computerization, social media, increase in patient awareness, etc., has added new challenges in front of us as a doctor in our practice. Ideally, the ethics deals with rights and wrong conduct. Whenever I in my clinic, when I expose to the patient from history taking, making diagnosis, investigations, preparing treatment plan options, at every step I has to require to take a decision, either it is right or wrong conduct on the basis of ethics, priority, patient priority, community priority, with what we ought to do and what we should refrain from doing. That is the basic question. The medical ethics concerns with how to handle ethical problems arising out of care of patients. Often clinical decisions must consider more than just the patient's medical condition. Ethics is not the only discipline that deals with these issues. The law and theology also prescribe certain behaviors. Law is concerned with rules enacted by a certain society and that have effect within some sort of limitations. Ethics has described as beginning where the law ends. That is very important. Again repeating this sentence, the ethics has been described as beginning where the law ends. Ethics is knowing the difference between what you have a right to do and what is right to do. That is two separate entities. Ethics is knowing the difference between what you have a right to do and what is right to do. That is the most important component that explained by this single statement, and that is the best foundation, need, requirement to adopt medical bioethics or ethical consensus, ethical approach, framework in our mind through a technical education. Hence, the Medical Council of India or NMC introduced this ethics in our practices. Now, when we see the as a overall current issues like abortion, blood transfusion, artificial life, stem cell therapy, human organ for transplant, gene therapy, these are number of issues where we need ethical base to take proper decision. Rather than this, the list is quite big. I just introduced a simple few modern aspects of modern practices in front of you in this course. But other than this, there are a number of reasons, there are a number of factors, there are a number of interventions. These modern interventions makes us bind to take a decision, proper decision, ethical decision in our practices. Now the question is our approach towards community. When we consider our approach towards community, 4 basic principles of medical ethics that are autonomy, beneficence, non-maleficence and justice. These are 4 basic principles of medical ethics, or these are also called as the foundation principles of medical ethics. But when you see as a overall, there are number of other principles rather than this. But when we start learning medical bioethics, these are the 4 pillar principles, that is autonomy, beneficence, non-maleficence and patient justice. Rather than this, there are a number of list of other added principles of medical ethics. Now in this practice, during learning from first MBBS, we will learn these principles, these aspects one by one in our curriculum. Now in this foundation course, you should know this nomenclature of these 4 basic principles. What is autonomy? Autonomy means the patient has a right to choose his own treatment plan, or patient has a right or autonomy, or he has a right to choose his treatment plan options in any way. That is patient autonomy. Second is beneficence. What every act you are doing with your patients should be beneficial to him. That is beneficence. Third thing, non-malice. When we make any kind of intervention with your patients, that should be done with the intention so that patient should not be harmed. That is, do not harm. That means non-maleficence means do not harm to your patient. And fourth one is justice. What you are doing in everyday practice should justice to your patient, should justice to your community as a doctor, as a professionals. Now when we see the basic principles of autonomy, the principles of autonomy are based on the right of individuals to self-determination. Nowadays, clinical practice is shifted more patient-oriented. The value of autonomy is increased nowadays because patients' awareness, technology, smartphones, internet are all the knowledge are in the hands of patient, and patient determines, patient can more judge his options, patient can more read on smartphones to associate his disease or options in medical practices. Hence, our responsibility are nowadays are more increased in medical practice than previous days. That means this modernization that leads increase our responsibilities as ethical grounds of view as well as non-ethical grounds of view. That means other parts rather than ethics. By autonomy, it is patient right what he wants. That is important thing. Refusal to treatment or any investigations or any surgical procedure is sole autonomy of any patient. That is very important. Autonomy is considered as a general indicator of the health. That is very important. Hence, right to refuse a treatment should be considering fact under all observations and with good faith. This is highly challenging with few cases like mentally ill patient, pediatric age group patients. That time, their coordinators or their associated family members take that decision with him because that persons are unable to take the decision, but their relatives, their consensus take their proper decision associated with their further treatment plan or management. In that cases, psychiatrists, psychologists play an important role in protecting rights of these patients in these cases respectively, mentally ill and pediatric cases. In other cases, it is clinicians' first priority to maintain the autonomy of patient irrespective to other values. Most of situations, patient is in not a situation to take a right decision due to any burden, due to stress or ignorance or lack of knowledge. There are a number of reasons that may faces the situation in him or in that condition he is not able to take proper decision. That time it is our responsibility, it is our moral responsibility to explain him that situation, that option, that priority to your patients. That is important. That is important implication, that is important intervention should be done by you on ethical basis. The doctor must provide patients with proper information. Doctor help them make informed choices. He should respect their right to refuse the treatment. That is very important. Doctor should ensure openness with his patients. Doctor should maintain patient privacy and doctor should help restore their independence. That are the priorities that should be done by the doctor in emergency as well as in non-emergency situation or while he advise or you advise to your patients with proper information. We should explain all choices, we should explain him all options. You should encourage your patient, you should encourage in ethical way to resolve or solve his queries. Physicians have a standing duty to respect and at times an obligation to help to promote the free choices of competent patient. That is very important. Now, autonomy it simply refers to the right of an individual to determine what activities they will or will not participate in with their wish or decision. The autonomy implies having power over making decisions relevant to oneself. To be autonomous, a person must evaluate their options rationally, based on facts and taking account of the consequences. That is very important. The notion of patient autonomy has significantly shifted the medical practice away from its earlier paternalistic approach in which the doctors knows best. The doctors knows best was the initial approach that was adopted in 90s, in 20th century. But in 21st century, this statement that doctors knows best is slightly behind due to the certain intervention in our 21st century. This may be either smartphones, laptops, internet, because the every information associated with our diseases are seen over there. The patient can easily read this. Patient can easily trace that components, trace that knowledge over the net, and he may be argue with you. When such situation where the patient argue with you or patient ask you to be opted him the best option, it's our duty or responsibility that you should give him the proper guidance, support. You should solve his queries. You should give a confidence. You should give the priority, and you should respect the patient priority, patient autonomy. That is the best practice. Now, with this growth in patient-centered care in worldwide, the principle of patient autonomy has become established in law. That is very important. That means the patient autonomy nowadays introduced in the law. Law also explains us these facts. Now, today's foundation course, as a first introduction, as medical bioethics, you should learn this fact that patient autonomy as a first basic principle in medical practice. That means, in conclusion, the autonomy is the right provided to the patient. Simultaneously, doctor has to obey principles of beneficence and non-maleficence. That means he has to provide the best treatment to his patient and see his patients should not suffer any harm during the treatment. That means when we conclude this slide, as overall, in such situation, these are the four pillars. One, autonomy, that is patient rights. Secondly, the beneficence, that is what you are doing everything that should be beneficial to your patient. Your every act, your every decision, your every explanation, your every skill, knowledge, and your overall approach towards handling your patient should be beneficial to him in every way. That is known as beneficence. That means we understand today in four principles. First, autonomy. Second, beneficence. Third, non-malice. Non-malice means you should not do such an act, should not take such a decision, should not intervene your patient in such a way that there should be harm to your patient. That means non-maleficence means do not harm to your patient by any means. What you are doing, every act, every decision, you should explain to your patients what you are doing, what are the possible options in the treatment plan, what are the possible harms in the different options you are putting in front of your patients. That time, the patient may sometimes may be unable to take that decision, what is my correct treatment option. That time, you should explain him the proper ways. I just give a simple example in front of you, as in foundation course, as an introductory part. Suppose a patient come to you with pain in abdomen. That time, yes, when you confirm it on clinical examination or other investigations, and he found it is related to the appendicitis pain as an acute. That time, in emergency situation, what are the possible options that are with you and with your patient? Suppose in that case, you require or you take a decision, there is a need of urgent surgery. That is surgical intervention. But patient is unable to take that decision due to his fear about the surgery. His relative is also in fear or in stress. Or the second reason may be they may not have that specific amount to go for that surgery. That time you should explain your patients in a proper way what are the other options, why you choose as a surgical as a priority here, what is its need. Because if you give option to your patient autonomy to choose only the medical management and you leave your patients and patient go in a danger in further in future complications, that time you has to put proper option with proper implications and proper explanation to your patient what to be the harm if you not choose or go in that way. That is, this is known as non-maleficence. That means do not harm your patient by your decision, what you are taking the decision with your patients. This is just not be the patient autonomy. Patient autonomy is one pillar, beneficence is second pillar, non-maleficence is the third pillar, and fourth one, obviously the justice is the fourth pillar. That means what we are doing or intervene with all previous three pillars. Justice is the fourth, it is not an independent pillar. What you are doing with your patient, you should provide justice to him. What you are doing, what in how you are managing your patient, you should give a fully justice at patient level, at his family level, and at a community level. That are three levels he has to simultaneously face in your clinical practice. Here, what you are going to be introduced or what is going to be managed your patients, you should think the justice at all level. That means in conclusion, in means foundation course, we found the need of medical bioethics. The medical bioethics explain us all these facts in a systemic manner. In this introduction, I just explain you today what is medical bioethics, what is the basic framework of medical bioethics. The students, the basic framework of medical bioethics is based on these four pillars. In our subsequent career, in syllabus of first MBBS, second MBBS, and final MBBS, we introduce this in a detailed technical way. In as an introduction to this subject, medical bioethics, we introduce this in three groups. First, as a basic foundation principles, what we introduce in today's session as a 4, but rather than that list is up to 10. But these are secondary, like patient consent, confidentiality, patient privacy, that are different chapter wise we'll learn subsequently in our regular part in our MBBS curricula. Second part, that is in medical bioethics, are the different clinical issues like euthanasia, etc. That are second part. And in third part, that is a professional and communication approach. As a doctor, we should be competent with proper communication skills, with proper professional approach that is needed to us. That means the medical bioethics are such divided into three brackets. First part that introduce with you the technical parameters of ethics. That technical parameters includes all basic principles, advanced principles, recent principles. That is the first part. And second part, we discuss different clinical issues. And in third part, we discuss what and how we should become a complete professional, proper professional with a professional approach and communication skills. That means that include these three parts in our medical bioethics curricula. When we see the base of medical ethics stands on this conclusion. That means today in this small session you understand what is medical ethics, why it is need to be learned, what are different components of medical bioethics, and we understand the base of medical bioethics, that is you are going to learn systematically in our curriculum. Now I would like to be conclude this session at here with a simple phrase of Mother Teresa. She says, medicine is a mission. It is not a profession and it is not a business. Sir William Osler, his famous statement, that is, you are in this profession as calling, not as a business, as a calling which exacts from you at every turn self-sacrifice, devotion, love and tenderness to your fellow men. Once you get down to a purely business level, your influence is gone and the true light of your life is dim. That means we conclude this part as medical bioethics, that we understand in this session what is medical bioethics, what is the proper approach, what are the components of medical bioethics in this curriculum. With these students, I conclude these sessions. After a break, we'll see the second session on medical bioethics in basic framework that is put in front of you in the form of ATCOM. Thank you students with these sessions, and with this we conclude this session. When we see this word ATCOM module, it is a phrase or word formed by ATCOM A, that is attitude, AT, ethics, and COM, that is communication. That means as an integrate ATCOM module that is based on attitude, ethics, and communication skills to become as ATCOM module. Now when we see this ATCOM module that is introduced by the NMC to us to learn medical bioethics in a systemic way. When we see the components of ATCOM module, there are basic 8 components: professionalism, effective communication, positive attitude, doctor-patient relationship, doctor-patient communication, conflict management, medical bioethics, and medical legal issues. These are the basic 8 components of ATCOM module. When we see as an overall, the entire concept of ATCOM module lies on the fundamental principle that changing a person's attitude can change his or her behavior. That is very important. The cognitive components of attitudes are more fundamental and constant over the time and more closely connected to basic values. The behavior attitudes are manifestations of underlying cognitive and affective attitudes. The ethical dimensions play a crucial role in behavioral evolution, and the basic building block of good communication is the feeling that every human being is unique and of value. That is the base. This ATCOM module was prepared by academic cell of MCI earlier in 2018, and that is introduced from 2019 in MBBS curriculum. In our phase 1, that is for first MBBS, this ATCOM module comprises 3 areas: bioethics, communication skills, and doctor-patient relationship. When you see the bioethics, medical bioethics is introduced in foundation course as dedicated hours, and in your regular first year syllabus, the bioethics is introduced as 20%, communication skill 15%, and to understand doctor-patient relationship to the first newly entered medical student as 65%. This is graphical presentation that explains us the weightage of these different components in this ATCOM module. Now the question, as earlier we discussed, why this MCI or NMC introduced ATCOM as special area in our medical curriculum. That time we should think where we are. The undergraduate medical education program is currently modulated and designed by the experts with a goal to create a medical graduate possessing requisite knowledge, skills, attitudes, values, and responsiveness so that he may function appropriately and effectively as a doctor of first contact of the community while being globally relevant. That is very important. Students, there are many new key areas recommended in this ATCOM module that are identified for implementation across the entire duration of our course, from first MBBS towards the last MBBS. At every step in phase wise, this ATCOM module is split in different module formats. In context of order, the medical graduate is not just play or not just physician, but he is also leader of society, communicator, as well as counselor, lifelong learner and professional who is committed for the best, ethical, responsive and accountable to our society, to our community. Doctor is not only person concerned with curative approach, but also accountable for preventive care, holistic care, promotive and palliative care of the community. The MCI has provided us guidelines regarding the applications and conduct in clinical practice. These detailed guidelines are available at MCI website as well as NMC website that is recently turned out. These guidelines included the professional conduct and ethical approach in clinical practice. These guidelines explain us the professional conduct, ethical conduct, lawful conduct in clinical practice, but their base should be introduced from the first of the entered MBBS course, and hence the NMC or MCI introduce this in a module wise fashion, and that is known as ATCOM module. These bodies introduce us this ATCOM in phase wise. Number one, they provide us a detailed syllabus what to be learned at every phase of our MBBS curricula. Rather than this, the good communication skill has a vital role in improving the doctor-patient relationship and leads to improved patient compliance, satisfaction with care and benefits to physical and mental health of patients. That is very important to be underlined. That means along with the ethics education, communication skills should be improved by a technical way, by a educational way. That means we require ethical views, we require founded, properly based ethical views, and we require good communication skills with a proper professional angle or proper professional base. Henceforth, along with the knowledge and with good skill, these attitude based components should be evolved. Henceforth, according to the Bloom's taxonomy that we seen in earlier class, hence we become competent as a knowledgeist, proper knowledgeistic doctor with a proper skill based and proper attitude based. This third area that is covered in this ATCOM module. Now the question is how to improve the effective communication and positive attitude among us. That is a basic question. Hence, the MCI or NMC introduced this competency-based medical education. The competency-based medical education and experience in clinical practice. The MCI or NMC introduced a number of interventions to us. There are a number of interventions that are introduced in our this CBME curricula. The basic three interventions that are ATCOM module, second ECE that is early clinical exposure, and third one that is integrated teaching. These are the three components that are introduced in our CBME curricula, that is competency based medical education curricula. Now the question, there are a number of issues that are covering in ATCOM based teaching, that are covering in ATCOM based teaching. What are different issues? What different competencies that we should know, that we should adopt, that we should practice in our regular clinical practice? Like listening of the patient, good listening, non-discrimination of your patients, patient care, confidentiality, ensures patient's understanding, devotion to service, patience, delicacy, responding to patient's questions, never hide anything from your patient, patient support by every way, by your every act and by your every decision, patient respect, patient autonomy, maintenance of ethical conduct, beneficence, dignity and honesty of doctor, and avoid undue patient advantages. These are few lists or issues that you should practice in your regular clinical practice by learning in ATCOM module. Now when we see the ATCOM components, there are 8 ATCOM components that are overall covered in curriculum. First one, professionalism. Second, effective communication, communication skills, positive attitude. Next one, doctor-patient relationship, doctor-patient communication, excellence in communication skills, conflict management, that is a very separate area, that is also introduced here. Handling of bioethical issues, that I already introduced in my earlier speech, and handling of legal issues. Because nowadays, this handling of legal issues also become a very separate component, and that you are going to be learn more in forensic medicine along with attitude-based education in your second MBBS curriculum. But you should know these are the basic 8 components that forms ATCOM. Today, through this introductory session, that you understand what is ATCOM, what are the ATCOM components, why there is need to learn the ATCOM, what is the implications of ATCOM, and what are the importance of ATCOM learning in our clinical practice. The second part, that is very important, because we are leaders, we are professionals. We are leaders and we are professionals. So what does it mean to be a professionalism? That is a basic question. Professionalism can be defined as dealing with patient with specific trustworthy attitude, behaviors and character that can create patient-physician trust. That is very important. Necessary for good physician with best knowledge and the skills required for patient cure, along with reflecting moral values. That is excellency in professionalism in medical or in healthcare point of view. And as when you are introduced in this medical curricula at this foundation course, you should know about this. You should aware, you should be sensitized about your role as a professionalism, your role as a good communicator, your role as excellent leader. Because doctors are not just a one-way traffic. Doctors are not like just other business like give and take or what he has to sell any product. But as a doctor, you have to see at patient level, at patient relatives level, and at patient community level. And you should be reflect as the excellent professionalism, excellent professionals, excellent good leaders with a good impact of overall your output towards your community. In clinical practice, doctors act as professionals, hence it is our responsibility to understand basics of professional approach during patient encounter in any situation. That is not to be teach or not possible to teach in one day. But throughout your curricula, in all phases of medical, from first MBBS to last MBBS, or internship at postgraduate level, you should understand, you should learn it by learning in class, learning in hospital, learning at clinical, that is from the classroom to the bedside teaching learning. You learn this approach through different experiences with encounter to your patients, and that makes you a perfect physician or perfect clinician. This sense of professional approach should be developing since undergraduate training in medical curricula. The main objective of doctor should be service to the humanity rather than financial goal like other profession. And that is the student, that is the basic difference between the medical professionalism and other professions in our society. Our goal should be service to the humanity. It should be our motto rather than just the professional as a money making machines. You should decide this where and how I should take what is right and wrong with you. Now this subject explain you all this fact not on the basis just on the basis of explanation humanism but a proper clinical realistic approach with emergency as well as in different situation that you are going to face in your professional career. Now when we see the first MBBS core area, as per the syllabus framework, the NMC introduces you the foundation course that is started in our university as well as all the colleges, universities across India. That is foundation course they are introduced for the 1 month. Second intervention that is the implementation of the ECE, that is early clinical exposure. Integrated teaching is the third intervention. Introduction to bioethics, fourth intervention. Communication skills teaching as a fifth intervention. And community visit that was earlier but they have given more stress on community visit as the sixth interventions that they highlighted in their new CBME curricula. In second MBBS core area, again the foundation course for short for 3 days to 5 days, integrated teaching, introduction to medical bioethics, studying basic principles of bioethics in clinical practice, professionalism, communication skill and basic research ethics awareness that are introduced in second MBBS. While in final MBBS, CBME introduced integrated teaching, communication skills, bedside teaching, patient interaction, handling of emergency situations, community visits. Along with, they introduced evidence-based medicine, implementing principles of bioethics in actual practice, different ethical issues in clinical practice like patient privacy, informed consent, written informed consent, patient confidentiality. These are a number of ethical issues that are introduced in your syllabus of 3rd MBBS. And legal issues that like MTP Act and different kind of acts, issues, laws that are introduced in 2nd as well as final MBBS core areas. Now today we are going to be highlight more on 1st MBBS. When we see the 1st MBBS ATCOM syllabus, that is CBME ATCOM syllabus, that is divided into 5 modules. Module 1, that is what does it mean to be a doctor? That is the title of that module. When we will start teaching from the first of day, these modules are divided in 3 subjects in anatomy, physiology and biochemistry. The anatomy, there are allotted 2 modules. First, what does it mean to be a doctor? What is doctor? What are the characteristics of ideal doctors? What the community expect from us? What the legal authorities expect from us? That are included in the first module. What does it mean to be a doctor? Different chapters are introduced, different lectures are introduced. There are different modules, sub-modules, units are introduced in the first part. And the second module for anatomy is cadaver handling ethics. Because when you introduce in the medical curricula, from the first day, you have to introduce with the cadavers. Cadavers are our best friends that teaches us a basic anatomy, structural anatomy, advanced anatomy. And what we learn, we feel the body for first time with these cadavers. Hence, you should know the proper ethical handling of the cadaver in a way that you respect the body, you respect the humanity, you respect to as a soul, individual. That all are learned or discussed in this module 2. In module 3 and 4 that are allotted to physiology departments, to our departments. In physiology departments, these are the 2 modules. Module 3, that is what does it mean to be a patient. what is patient, what are the expectations of patients, what are patient rights, what are the patient's criteria that expecting from the doctors, that all things are in discuss in this module number 3. In module 4, they require the doctor-patient communication. Doctor-patient communication basic foundation, doctor-patient communication basic requirements, different components, different angle to the relationship between the doctor and patients. And module 5, that is separately introduced and allotted to the biochemistry department, that is communication skills. The communication skills explain us how to improve our communication, our positive attitude, our positive approach towards community, that are learned in module number 5, that is communication skills. Now in communication skills, they explain us what is the basic foundation of communication skill, how scientifically different modules introduced to improve our communications, what is the importance of communication in medical practice, how I practice good communications, that all are introduced in these communication skills. Now, here I would like to share my book that is released in 2016. This is the cover page of the book, that is the textbook of medical bioethics, attitude and communications for medical students. Now students, this is the first textbook for medical bioethics with attitude and communication competencies required for medical students from Indian subcontinent, which is based on dedicated guidelines of ATCOM, and it is helpful for students for easier introduction to medical bioethics with attitude and communications competencies. This book was released in 2016 by CBS Publishers India. This book is available at every medical store across the country. It is also available in our library, our university library, departmental libraries. The book is also available in our store for the purchase. The book is also online available on different platforms like the Amazon or any platform. You can search on the net by this title, this textbook of medical bioethics, attitude and communication, and just put my name as Dr. MC Tayade. That book you can purchase online by any platform like Amazon, Flipkart or any you can use to purchase this book. This book gives a simply guidelines, included all the modules that is required. This book is covered, or this is the first book that is covered systemically, covering the basic syllabus pattern that is required for the ATCOM. This book is also written by me so that the first year students that is introduced to the community or that is introduced to the medical profession for the first time should understand this in a very simplified language. In a comprehensive way, I explain these different areas of bioethics, different areas of ATCOM and different areas of communication school. That means this book is important in all three base angles, that is written based on 3 angles, so that you can easily understand this in a simple way to be become competent in these 3 areas. This book as a best book that is already sold out more than 1 lakh copies from 2016, and my second edition is in pipeline that is going to be introduced in shortly. But now you just read this book as basic, that is useful to understand, that is useful to explain the difficult issue in a simplified way to understand this bioethics and ATCOM. This book is also helpful to your examination because this attitude ATCOM is introduced in every subject, anatomy, physiology and biochemistry, as a compulsory in assessment way. In our assessment, in every paper, we introduce 2 short notes compulsory on this module. Throughout the year, there are dedicated classes conducted in our regular timetable by anatomy, physiology and biochemistry departments, covering all the syllabus of ATCOM with a logbook. You have to fill the logbook. You can easily fill this logbook with the help of this book. You can easily understand the different difficult aspects of bioethics basic framework of bioethics with the help of this book. This book also covers the basic approach, basic understanding of medical bioethics. When I review a book in this foundation course with you, this book is divided basically into three components that I already discussed with you. In first part of this book explains what is bioethics, what are the principles of bioethics, what is the basic framework of principles of bioethics, and what are advanced principles of bioethics. That is the first part. In second part, I cover different ethical issues that are faced, intervene in our clinical practice. The number of issues are explained in this book in a proper way. And third part, including communication skills, attitude focused education, and different miscellaneous issues that are to be known by every students to be a complete competent as a professionalism. That means in this book I included professionalism, professional conducts, lawful conducts, different legal issues, different laws that are being implemented particularly in India, because this book is written from the India. Hence I just covered and highlighted major Indian laws that should be known to the medical doctors. And in this way I comprehensively cover all the components that is required to your regular teaching. With these students, I want to just conclude this session. Today you understand from this session what is ATCOM, what are the ATCOM components, need of ATCOM learning, what are the distribution of ATCOM components in phase 1, phase 2, phase 3, what are different weightages, their importance in as a professional, as a student, or as per assessment point of view. And then we discuss in second half of this session ATCOM syllabus for first MBBS, how it's going to be implemented, and what are the resources that you should read as concluding. With these students, I conclude this session. Thank you for listening these two sessions for ATCOM from me, and in foundation course I also thanks to our Dr. Phalke sir, our MAT coordinator, introduced me and give a time slot to be speak with you in foundation course on ATCOM. With this I conclude these sessions. Thank you students. Thank you once again. Okay, thanks. Yeah. Local.
Good afternoon, students. So today we began the session by Dr. Deshpande on various hazards, biohazards, vaccines. Then we had two sessions from Dr. MC Tayade on ATCOM module, and he has also explained about his textbook on bioethics. And today we will be uploading MCI document on ATCOM module on Google Classroom. So I request everyone to download the document and read it. We stop here. I declare that today's sessions are over. So again, thanks for watching, and we'll meet again at 10 o'clock in the morning tomorrow. Thank you.